good afternoon. Thanks for joining us on our spooktacular Halloween town hall. We are still going to go through this because we're going to record it. Brandon's going to put it somewhere. So this is our Halloween slash AEP so far agent town hall. We're going to give you some spooktacular tips and tricks about what we know from AEP thus far, and some very helpful hints that we've collected from you guys as agents to pass along to other agents. So, Brandon, we'll just jump right into it. We wanted this to be a little bit interactive, so you'll see our fun little furry ghostly friend there. And these are going to all pop up as a trick or a treat. So, was it something that was advantageous to you from the get go, or was it something that you have to get adjusted to? So, HMOs are now your new best friend across the board. This is what carriers are going towards. This is the type of business that they want. So, do you think this is a trick or a treat, Brandon?
You know, it could go either way, but I think we put this one as a trick.
Look at that. We were tricked. We were tricked into really falling in love with the PPO plans. There's really only a couple carriers out there that are doing PPOs well, Devoted being one of them, Blue
Mhm.
Cross Blue Shield of Tennessee being another. If it's not that, it's probably not paying commissions. So don't be tricked with PPOs outside of Devoted or Blue Cross Blue Shield of Tennessee. Use your new friend, the HMO, and that will be your new treat for this AEP. This is why HMOs are a cost efficient way for the carriers to offer steady benefits. And that's the truth. Having a more narrow network allows the carrier to control their cost a lot better. These should allow for plans that aren't going to see a whole lot of attrition in years to come. So this is definitely a treat.
Treat.
Look at that. It's like the Reese's of Halloween right there. So just keep that in mind as you're getting adjusted to selling HMOs. They are going to offer you much longer plan opportunities for your clients. You shouldn't have to roll people plan to plan as often with these new HMO designed plans.
And we've seen a steady increase in PPO reduction slash HMO increase over the last couple of years. It's not as drastic as it has been this year, but we have seen that trend going that way, just based on what we were talking about here with that it is more cost effective for them and the longevity of the beneficiary being able to stay on that plan and not have to switch every AEP. It makes it beneficial for everybody.
It does. It really does. You'll have to pay closer attention to networks. But you all are running doctors and drugs anyways. If you're not, you should. And that will save you most of the heartache that goes along with an HMO. Plus, these national carriers, Brandon, like Aetna, Humana, United Healthcare, even Devoted and a few other carriers, they have pretty much seamless national networks. So you're able to log in to your client portal if you're traveling and need to see a doctor that's not emergent, and you can still find providers that are in network in areas outside of your home state. So that's always available to you as well. All right, so trick or treat with SSBCI. SSBCI allows for carriers to still offer many value-added benefits like food cards as long as your client has a qualifying chronic illness. Those qualifying chronic illnesses are a laundry list of things, and carriers are making it as simple as possible for those illnesses to be verified and the clients to get their value added benefits. Personally, Brandon, I think that this is probably going to fall in the treat category, but I'm going to let you figure that one out.
Well, let's roll the dice here and see what we get.
Yeah, treat. What's your favorite Halloween candy, Brandon?
I'm gonna go out there. I'm gonna blow you away on this one, and it's on the screen. Halloween candy is candy corn. I'm a big fan of candy corn. Love it.
Wow. I think you
Yeah.
might be out there all by yourself.
Every time I bring that up, somebody looks at me like I have three heads, and it just, I don't know, something about it. And the little same kind of flavor though, the little pumpkins that are the candy corn-esque pumpkins, not the green and orange ones, not the black and orange ones. Black and orange ones, I don't know what's going on there, but yeah, I'm weird in that. So
All right, we're going to let you have your candy corn there.
yeah.
All right, so D-SNP and C-SNP, these are going to provide a year-round enrollment. D-SNP is prefaced with in most areas. These come down to the highly integrated and fully integrated D-SNP plans. So the state of Tennessee has fully integrated D-SNP plans. The state of Georgia has neither. So in the state of Georgia, D-SNP would not be a year-round enrollment. If your state is kind of an unknown to you right now, give us a call. We'll help you figure that out semi-quickly. But what that allows for is for a client to move their Medicare plan to their Medicaid provider. So it sounds a lot more confusing than what it is. Everybody, once they're on Medicaid, is assigned a carrier, a Medicaid carrier. There's only so many within each state, and that Medicaid carrier, for the longest time, did not have to be your Medicare provider. Now they are wanting to streamline the process and make everything as unified as possible. They want your Medicaid and your Medicare carriers to match. And that just really makes a whole lot of sense from a health standpoint. It allows them to manage your care a whole lot better, as well as the cost of that care. There's a lot of things that we think that we're doing the best for ourselves. We're really not. There's tons of visits to the ER that could easily have gone to an urgent care or potentially to a teledoc or a provider and gotten the exact same outcome. They're not telling you don't use the ER at all. What they're telling you is that there are different ways to manage that care at a much better price point. There are certain drugs that providers will prescribe that may interact with the drug that you're already taking. Having these types of care managed will help pick up on that a lot better, and just provide overall better health care. C-SNPs are year-round enrollment in any area that they are available, as long as your client has a qualifying chronic illness. And those C-SNPs are very benefit rich. So keep that in mind. If you qualify for the C-SNP, you qualify for the additional value added benefits like those food cards. So I'm just gonna steal this one. I'm gonna say this is definitely a treat. 100%. Not the candy corn type of treat though, more like a Hershey bar.
The good kind.
Sorry,
The good. No,
Brandon.
it's
Couldn't
okay. It's
resist.
all right. I'll say too. You were talking with the DSNP integration there of Medicare, Medicaid. That is something that has come out within the last year, and it does sound confusing. But again, to Courtney's point, if you have questions about your state and what's going on there, please reach out to us here at National Contracting Center. Either myself, Courtney, your sales development manager. We'll walk you through it because there are still opportunities for this. And if you haven't leaned into the CSNP opportunity yet, most of the population that were, let's say last year, on a DSNP more than likely have some sort of chronic condition that would then allow them to qualify for a CSNP this year and give you that extra opportunity, even going into 26 to next year. Once we get out of AEP, I'm not sure when people will be watching this, but the CSNPs give you that extra opportunity to have that conversation, give your beneficiary some of those extra benefits. So if you haven't leaned into the CSNP writing just yet, I would encourage you to look into it. Reach out to us here at National Contracting Center. We'll definitely be able to walk you through how to get started with that.
Absolutely.
So this one,
Okay. Well,
this one.
yeah, this one's a lot. Brandon and I have been swimming in all of these issues, more him than I, but it is it's definitely dark out there, Brandon. So I'm gonna let you take this one.
Yeah, so this year, for some reason, we tout technology as being a help. We even have AI bots that are helping us. For some reason this year, they're not. The ghosts and the goblins have gotten into the system. So I'll go ahead and just put this on the screen. We got tricked into our enrollment platforms working like they should, right? And so what we're seeing this year is there are issues with the platform, whether it's Sunfire, whether it's carrier platforms. Let's say Jarvis. I know that was having an issue the other day. Think Agent with Aetna has had issues this AEP, and so we know that that can be frustrating. And what we ask though is it's your electronic tool is still going to be your best opportunity to write more business, but just know that there may be glitches, there may be spooky things happening out there. You may log in one day and a carrier RTS doesn't show up because maybe they didn't send the right file to the third party, so to Sunfire. Or let's say you, for some reason, you get a new computer and you go to log in to Enrollment Central, our online platform powered by Sunfire, and it says unauthorized user. Those things happen. And so we're here to help with that. Courtney mentioned just a second ago that we've been swimming in that. I live pretty much right now in the Sunfire back office platform, helping with usernames, passwords, RTS issues. If you do come across situations where, let's say, a formulary doesn't show up right, let's say you've logged into Jarvis and you're looking at UHC, looking at their plan there, and then you go on to Enrollment Central into Sunfire, and something doesn't match up. Please do us a favor. Give us a screenshot of that so that we can send that over to them to help correct that. Because let's be honest, the tools are only as good as the data that's being given to them. And sometimes that data is behind in getting to them. So let's say that they update their formulary on Wednesday, but the last report that Sunfire or their third-party tools received was on Monday. Well, then the information that's on the platform is 3 days old, right? So we also are seeing right now Medicare.gov is not being updated as often as it has in years past. We know why that is because of the shutdown right now. So there's all kinds of issues with this, but we do know, even with those issues, that our online enrollments, our e-tools are probably still some of the best tools that we have. We just have to go with the flow, right? And so again, if you notice issues, doctors not in network, but then all of a sudden show in network, get us a screenshot of that if you can. Or if you try to log into Enrollment Central and you get that unauthorized user, please give us a screenshot with the URL at the top so we can kind of see what's going on. We can triage some of this. Some of this we do have to pass on to our partners over at Sunfire and get them to do a little bit deeper research into that. But that we did get tricked on those. Courtney, anything you want to add to that?
I would just say, to echo what you said, is make sure that you have multiple ways of doing the e-enrollments from Sunfire to the carrier website to whatever that may be. Have a couple different options because while Brandon and I are quick at helping you get in if you are having permission issues, we're not available 24 hours a day, 7 days a week.
Yeah.
We're close at this point. But you know, everybody needs a little bit of a break, and sometimes we're in a meeting. Sometimes we're hosting a webinar with you guys. So please have multiple ways of enrollment so that you're not stuck. If you know that you've had an issue with a particular carrier, check it. Check it before you go to the appointment, and give us that opportunity to fix it while you're en route to the appointment or while you're waiting to make that phone call, to make things just a little bit more seamless for you guys. Outside of that, I think it is all in preparation.
Absolutely. One last thing I'll say too is I know we're in AEP right now, and so that's the primary SEP that we're writing business under. But if you happen to be writing, so you trying to use an SEP to write business, let's say for a 11-1, or if you're going to write a 12-1 business, and you get an error message on that, please, I'm going to echo this again. I can't echo this enough. Send us a screenshot of what the system is saying, because we'll need that to be able to send to Sunfire to address whatever's happening. Sometimes it's the carrier has said we won't recognize that SEP, but sometimes it's a date issue. We have the wrong date in, especially with if you're trying to use the DST SEP. They've really cracked down on the date issues of these. So if you run into situations like that, just reach out to us. The best thing you can do is
Check the
either
year.
right, check the year,
Check
make
the
sure you're in, yeah, make sure you're in 25 if you're writing 11-1 or 12-1 business. But also shoot us an email at enrollment.central@nccagent.com, and the Enrollment Central team will take a look at that, get on it, start processing that issue, whether we need to send it to Sunfire or whether we can address it in-house. We'll definitely get it done. Let's move to the next one here, Courtney. Let's see what this is.
Ah, so this is where you can be extremely helpful to your clients. So C-SNP verification is definitely needed for a C-SNP plan, but it is also needed for those SSBCI benefits that are on normal plans. These are verifications that you can help your clients with. And this comes in the form of education and sometimes with printed forms that you can hand to your clients and they can take to their doctors. So these C-SNP verification forms, I'll use United Healthcare for an example. They reach out to the doctor to get a form filled out. We all know that doctors' offices aren't necessarily the most responsive places in the world. But we also know that some of our clients with chronic illnesses are visiting the doctor on a consistent basis, at least once a month. If they take that form to the doctor, they have the doctor fill it out and fax it while they're there. Boom, your client's approved. And that just really cut out a whole bunch of back and forth and allowed your client to start getting those benefits as quickly as possible. So now that we're in this anyways, happy Halloween, uh, of having to have a chronic illness in order to get those value added benefits, you really have to make yourself aware and educate your client as to the process of what getting approved for those benefits looks like and how they can help make sure that their doctor gets the carrier everything they need. This would be a treat. It's a treat for your client to better understand the process. It's a treat for you to not have to rewrite your client if they don't qualify for the C-SNP within that first 60 days. Overall, this is a solid win with just a little bit of additional education.
Which leads us to our next
There it
question.
is. Educate your clients. They're going to end up referring you more business. If you're in a situation where you're meeting with a lot of clients who are already on the best plan for them. You did a super good job for them last year. You don't have to move them. Ask them to bring a referral with them to your meeting. You can pay up to $100 for a referral that ends up in a Medicare enrollment. Some of your clients, $100 would make a huge, huge difference too. Um, there's some looming things around SNAP benefits and, government assistance while this shutdown is in place. If you can put $100 into the hands of one of your clients that gave you a referral, I think that that would make a big, big difference for a lot of people. Um, People are way more apt to refer business to you if they're comfortable with how you did business with them. 100% that lies within that education factor of a Medicare enrollment. So education being key to referrals is a
It's a
treat.
big treat. It's a big treat. I was talking with an agent just the other day, and he was talking about, uh, we were in the conversation because you said this just a second ago, and I think this bears repeating. He was running multiple appointments for beneficiaries, and he wasn't moving their plans. And so essentially, he was kind of down in the dumps. He's like, I'm doing all this work. I'm not making any money. And we had the conversation about referrals, and that is a great opportunity of presenting the need for a referral is, hey, we've got you in this plan. This is the right plan for you. Who do you know that I can help in the same way? And then obviously, if we can compensate for that as well. um, I know a lot of agents have built large books of business. So if you're a newer agent listening to this or watching this, a lot of our agents don't really pay a ton for leads. They operate off of this referral system that they do good business, they help their beneficiaries out, and those people then go and bring other people to them because they know and they trust them, and they know that, okay, I'm on the right plan. I've even seen agents that say, look, I could sell you this other plan, but you're in the right plan. Like, this is the one for you. And so that opportunity to of a beneficiary knowing that, hey, he could have sold me something different, but he didn't because I was where I needed to be, that gains that trust. And then obviously, if we can provide opportunity for compensation to bring someone else, and I help them and I get them on a plan, uh, it's a win-win for everybody there. And to your point, Courtney, as far as in the time that we're in now, with some things that are looking like they're going to happen in the next few days, as far as benefits being cut off, um, just $100 would make a lot of difference in a lot of people. So it's definitely something uh, that is a treat.
Absolutely. Absolutely. All right, well, here's this. PDPs are pulling commissions, so we're going to know what category this lies in. This is a trick. This is probably one of the more upsetting things that's been going on the last couple of years. Just keep that in mind. If you're selling Medicare supplements, you definitely want to do the right thing by making sure that your client knows that they need a PDP, or they're going to be at risk of getting a penalty. So again, I'm going to go back to the education piece of this. You really need to make sure that you're doing the best thing for your client, and that's in explaining everything around Medicare, what could potentially cause them a penalty, and what they're going to be fine with not having. But PDPs could incur somebody a penalty. You don't want to do that. You want to make sure that even if you don't want to handle the PDP enrollment because you're not going to get compensated for it, that you point them in the right direction so that they can properly handle their own PDP enrollment. So while this is what we are labeling a trick as far as it is not beneficial to the agents, you do want to make sure that you make it a positive experience for your client, thusly allowing you to get more referrals, which leads to more treats. But this is out there. Pay attention to it. Right now, after November 9th, Humana will not be paying commissions on their PDP enrollments, leaving Cigna to be the lone PDP compensation carrier. And that's only in some states. So if you have questions around that, please call your friends at National Contracting Center. Let us help you figure out what, if anything, is going to pay on your PDP enrollments, and give you some helpful hints around best practices to handle that, making it a good experience for your client and not putting yourself at any unneeded risk.
One thing before we move from this topic here, Courtney, is I know some agents, you mentioned this a minute ago, as far as taking the time to go through the PDP, and it's time consuming, and it's, you're doing it for no compensation, essentially. However, if you do want to continue to support your beneficiaries on this, you can use your Pearl in Sunfire to send to a PDP customer, and they can go in and they can self-enroll themselves if they know what plan they want, or if you talk to them and you want them to do the application, you can send them that link. They can go through and they can do the enrollment. Obviously, there's no compensation there, but you still are their agent. And so you're providing a tool for them to assist them in doing their own research, because they can put in their zip code, they can look at all the plans that are available, and then they can decide which one they want. If they want to ask you questions, you can set that up. You can set the expectation of how to use that with your beneficiary, but know that there's tools out there that you can allow a customer to self-enroll in a PDP, and you don't have to necessarily be fully hands-on. And you still, for Cigna, you'll get compensation for that. All the others, you still remain agent of record. But think about this too. When someone can make their own health choices, and they're like, oh, I can enroll in this, and Brandon helped me enroll in this. There's some pride in that. There's some support in that you know the beneficiary is going to feel good about what they're doing. Now, granted, you want to have that education conversation about everything that's available. Are they in the right plan? Are they in the right path with a MedSup and a PDP, or do they need to be on a Medicare Advantage plan? I know there are still people out there that don't want to hear about Medicare Advantage plans, but are we having that conversation? If they still want to stay with the PDP, know that you can send them that link. It's in your agent profile on Sunfire. If you have questions on that, you want to know more, we do have a video up on our YouTube channel on how to use your Pearl. If you need further information about that, reach out to your sales development manager, reach out to myself. We'll be glad to talk you through that. But it is something that will allow your beneficiary a little bit more autonomy to just enroll themselves, and you don't have to do it for them.
100% agreed. Those pearls are crazy useful. So this is one of my favorite topics. I talk it to death. It is truly a huge value add that a lot of agents walk away from. Hospital indemnity plans are key to taking a Medicare Advantage and really giving a client full coverage, assuming that they can afford it. Indemnity plans pay money to the client to use as they see fit. So you might say, well, Courtney, the Medicare Advantage plan that I sold this client, it doesn't really have any copays, and the hospital stay copay is very minimal. And I might say, well, Brandon, what if your client had to miss work while they were hospitalized? They might need some extra money. And an indemnity plan doesn't care what your insurance paid. they're paying out the benefit as it is written into the plan. So please keep that in mind. These are plans that should be offered at every single appointment that you have, whether it's an ACA appointment, whether it's a Medicare appointment, whatever the case may be. Offer these plans. They can be extremely cost friendly. They have no networks, which means if your HMO plan loses a doctor or loses a hospital, your client still has fairly decent security in knowing that they have an indemnity plan. And if something happens and now something is out of network for them, this plan can pitch in and help them cover that cost of getting the care that was the best for them when no enrollment period was available to help them move to a plan that did have that doctor or hospital in network. Indemnity plans are a safety blanket in so many ways, and not that fun blanket that makes you a happy little Halloween ghost. But these plans are truly a, Brandon, treat. These are a treat for your clients. They're a treat for your pocketbook as well. If you're an agent, you know that Medicare Advantage plans aren't paying through AEP. They're going to pay you in January, which means money may be tight for the next couple months. We have some holidays coming up. These plans pay in real time. They're also a treat for your wallet, not like buying Halloween candy, the anti-treat, really, if you've had to pay for that here recently. But these plans are going to put money in your clients' pockets. They're going to pay you commission as well. These are truly a spectacular treat on so many different levels.
Absolutely. These work. I love that you made this point multiple times, but they pay the beneficiary directly. And a lot of times when we think about using insurance, we think about it for, I go to the hospital, I have an issue, my insurance pays for that issue. That's the case with indemnity, but it pays directly to the beneficiary. And so there was a situation I talked with an agent just the other day where they had to travel for care. They were able to file a claim with their hospital indemnity policy, and that money came while they were on the travel for the care, and they were able to pay for a hospital, or not hospital, a hotel. They were able to pay for some meals. So it's not just for the thing that's being taken care of medically, right? So it's whatever they're paying, that money can be used for whatever the beneficiary wants it to be used for, whether they want to pay their copay, whether they want to pay their bill, or whether they want to use it now to, in this case, pay for the hotel bill or some meals while they traveled, that type of thing. They really are a complement to a Medicare Advantage plan. Also, these can be written under 65. So they
Yep.
don't necessarily have to be written with Medicare Advantage. So if you have a family that you know that has small kids, hospital indemnity plans can be written, not small kids, but older kids down to 18. But also those parents need this policy too, because what happens if the dad's out working in the yard and falls off a ladder, breaks a leg, has to go to the hospital? Well, that income may be impacted for a while, but if he had that hospital indemnity policy, then that could potentially pay them some while that's being taken care of. So there's a multitude of things here. They also, like Courtney said, pay you in real time so that you can uh, get some extra money during AEP. Uh, your candy comment there, I remember buying Halloween candy when my kids were smaller, and yes, that's a hospital indemnity. That's one hospital indemnity sale is one Halloween candy purchase. The benefit of kids growing up and going to college now, my kids, they buy their own Halloween candy, and I get to shop the 50% sale tomorrow at Walgreens and Walmart and Target and buy the candy for half off, and we go
Brandon,
from
your
there.
candy corn is always on sale. I can promise you it's always 50% off. It never goes stale. No
All
worries.
I don't even have to go buy it. I just have to go to houses and say, "Did you eat your candy corn?" And most of the
Yep,
time it's no, and they're like, "Hey, please take this out of my house." So we'll go
that is
from
accurate.
there.
So this is actually something I've been working on this morning for an agent. They are possible, but I'm telling you, if you haven't thought about it, you're late. Last minute events can still be scheduled, whether it's sales or educational. These are possible. Your friends here at NCC, we're going to help you, but we need to do it sooner rather than later. So if you're new to the Medicare game, if you're worried some things haven't worked out the way that you thought they would so far this AEP, give us a call. We can find you some last minute events. We can work with your local broker managers as well to make sure that those events are filed appropriately. Um, they're possible, but they need to happen soon. This is a big, big treat, but it's like a fire sale. This is past that 50% off. This is that last bag of Reese's, not candy corn, left on the shelf that's marked down 75%. You got to grab it quick or it's definitely going to be too late. So if you need an event, call us now. We can do an event in a box. We can get you everything scheduled, filed appropriately, but we do need to act now.
Yeah, the speed is our friend on this, because we are running out of time for some of these, especially we have to find venues, we have to find uh, well, I'll speak from the marketing side. We have to create the content for you if we don't already have it. So uh, we are getting tons and tons of requests for custom content. We don't mind to help, and we love to do that, but the queue is stacking up. So if you need something, if you want something, as Courtney said, reach out ASAP, and we can get that for you. Also, if you're watching this after AEP, reach out to National Contracting Center. We can help you with your events even after AEP. But for the purpose of this program, we're talking last minute events before the holidays. Definitely can help you get in front of more people in just a single appointment.
Good call on that because OEP events
Mm-hmm.
are really what we should be thinking about right now. So those are simple compared to these last minute AEP events. So give us a call. Um, and that's a great segue to this right here. This was probably one of the smartest things that I have heard from an agent this year. I was talking to an agent the other day, and he's like, "Yeah, I'm sitting with the client, and the first thing I have them do is save my phone number in their phone. Your insurance agent, blah blah blah." That's crazy smart, right? Because then if they have a question, they're going to pick up their phone and say, "I know I have my insurance agent saved in here," and they're going to be able to pull you up right away, which means they're going to call you when they have a question. It also means they're going to call you when they have a problem. Both of those things are insanely positive because it means they're not calling an 800 number.
Yep.
It means that they're less apt to answer a telemarketing phone call thinking that it could be their insurance agent. A lot of numbers are getting spoofed. If it doesn't come up with your name, basically train your clients not to answer. This is insanely useful. It's the easiest conversation to have when you're in a sales appointment. And you can even say, "Hey, I'm going to call your phone because I want to make sure your number's saved in my phone so I can answer when you call." Make this a two-way street. It will really put your clients at ease and it will really cut down on the amount of over the phone enrollments that you lose clients to. This is a huge, huge benefit. It was a great tip from a wonderful agent. This is my favorite Halloween treat.
Yeah, when you sent the notes over to create this presentation today, and I saw this one, I was like, it that makes so much sense. And sometimes
100%.
the things that make the most sense we don't really think about. Um, I was talking with a colleague yesterday, and I said, I give people the benefit of the doubt, and I hope that they have common sense. And a lot of times, some people let me down, but that's on me. I get that. But this is a great tip and something that I do think uh, could be implemented super easy. Like you said, you're sitting down, hey, I want you to have my number. Because a lot of times we hear at the end of AEP that, you know, an agent says, well, I wrote this person back in October, early November, but they're not showing up on my report because somebody else called in late November, early December, rewrote them in this last app in, so we didn't get the business. This can help cut down, like Courtney said, on your beneficiaries picking up the phone and answering questions to another agent. If they know
Hmm.
that you're their agent and the phone rings and it doesn't say Brandon Hall, insurance agent, and I answer it and they start asking me questions, then I know I don't need to answer those because it's not my agent. And so uh, I know a lot of times we get into the habit. I used to do this. Is just I made sure I left a business card, right? Well, that's assuming that that person is going to take that business card and then enter that number into their phone. A lot of times once I walked out the door, they either filed that business card somewhere, or they threw it away, or they definitely didn't go grab their phone and start entering the number. But if I called their phone while I'm sitting there with them and say, hey, that's my number, go ahead and save that. And if they need help, if I'm sitting with them, I can help them save that number. And then vice versa. I put their number in my phone. And that way, if they call, I don't, because I'll be honest, I don't answer numbers on my personal phone that I don't know. But if
Same.
I have that number saved as Courtney Vidas, uh, non candy corn eater in my phone, I'm like, okay, well, I'll answer that. You know, I also I may not put it in as Courtney Vidas never seen Star Wars and not answer the phone because we can't be friends that way. But I would still answer the phone because I have her
The
number
force is
saved.
strong, Brandon.
At
I
least
still
you get
know
the
enough
reference. You
about
still
Star
know the
Wars.
reference. We won't go down that rabbit hole for our agents. We'll do a side podcast or something on that. Why Courtney and I can't be friends because she hadn't seen Star Wars. Anyway, this number thing I think is a fantastic treat for you guys. And if you aren't doing it, please make that a priority in your appointments the next couple weeks, is getting your information at minimum your information in your client's phone and see what that can do for you.
Yeah, 100%. I'm just going to give a shout out. Josh McLean, best tip in a long, long time. We appreciate you, sir. But thank you guys for everything that you do. We hope that you find some fun on this Halloween and take a little tiny break away from the craziness of AEP. You all are amazing. If there's anything that we can do for you, please give us a call. Myself, Brandon, any member of our NCC staff will be happy to help you. Throw in some little funny punnies for you along the way as well. Because if we can't laugh and smile, we're probably hiding somewhere and crying, which is not something I prefer to do. So let's have a little bit of fun, make it a great AEP, and take some pressure off yourself by knowing you have friends at NCC to reach out, give us a ring. We'll try to solve your problems. But other than that, have a fantastic Halloween. Have a great day. Thank you so much.